Are you a medical student at UO? Are you interested in global health but have no idea what is happening at UO or how to get involved? If you answered yes to any or none of the following questions, stay tuned to learn more. So first off, what is global health? Global health is an expansive field that has multiple meanings and definitions to individuals based on their past experiences. At uOttawa, our goal is to encapsulate these definitions into one common goal: to decrease health disparities. Local, national, and international initiatives are all of interest to students. Therefore, at our school, global health has numerable pillars to address this diversity of understanding and work at various levels of society, all in the face to reduce health disparity. As alluded, there are multiple groups working to decrease health disparities. These groups include the Global Health Office, CFMS local officers, student-led interest groups, and ASOC representatives. The goal of this video is to explain each of these pillars and how to get involved. So first off, the Global Health Office. The role of the Global Health Office is multifaceted. Firstly, the Global Health Office identifies and liaises global health opportunities to the VP Global Health to distribute to students. Further, they develop, enhance, and coordinate the Global Health Concentration, which is an MSPR recognized certificate. This certificate program aims to educate medical students to become global citizens. In doing so, medical students become prepared to work in the global health field in an ethical and informed manner. Consequently, this program also prepares students to become a strong CARMS candidate. To learn how to register, please follow the link below the video. We are so lucky to have arguably the most developed global health curricula in the country, so make sure to capitalize. Next up, the CFMS portfolio. The CFMS is a national organization designed to unite medical students from across the country on national and local initiatives. There is a National Officer of Global Health, which liaises with each school's VP Global Health. Further, working with the National Officer of Global Health and the VP Global Health are local officers of sexual and reproductive health, health education, indigenous health, and exchanges. First off, the local officers of reproductive health at our school work to advocate for access to reproductive and sexual health services and promote sexual and reproductive health for women, men, and the LGBTQ+ community. Events include talks on emergency contraception, workshops on IUD and insertion, and pelvic exams. Our local officers of Indigenous health organize local events and initiatives that promote awareness of Indigenous health issues. At UO, our local officers of international exchanges liaise and work with the Global Health Office in informing the students on international exchange opportunities, as well as coordinating the IFMS exchanges every year. Working with the Global Health Interest Group, the Global Health Office, the local officers of health education, coordinate, lead, and innovate the global health stream of the University of Ottawa Faculty of Medicine. Our Global Health Advocates, or GHAs, collaborate with other GHA representatives from other Canadian medical schools to promote awareness and advocacy initiatives on a designated topic. GHAs also participate at the CFMS Annual Lobby Day along with other GHAs, where they gather on Parliament Hill in Ottawa and engage in discussions with policymakers on particular health initiatives or issues. Such lobbying provides an excellent opportunity to exercise the health advocate role of the medical profession. Next, our Government Affairs and Advocacy Representatives, or GAC, work with students, government, and stakeholders to identify key topics for health advocacy. Further, they hold educational workshops and talks related to advocacy topics in order to further educate medical students on how to impact health policy throughout their professional careers. Our next big pillar are student-led interest groups. At the University of Ottawa, we are lucky to have multiple interest groups pertaining to global health. These groups include the Global Health Interest Group, Refugee Health Initiative, Inner City Health Interest Group, and Indigenous Health Interest Group. All of these groups plan talks with physicians and stakeholders, as well as assist students in finding volunteer and shadowing opportunities pertaining to their initiatives. Next up, we have our ASOC representatives, which include the VP Global Health and the Global Health Assistant. Our student body representation, ASOC, has multiple positions pertaining to global health, including the VP Global Health Junior and Senior, the Global Health Assistant, and Global Health Communications. The VP Global Health works with the various pillars of global health at the University of Ottawa. One of the key roles is to oversee and liaise all of the local officers, interest groups, faculty, as well as the Global Health Office. The VP Global Health is also responsible to connect students to global health opportunities. Further, they work nationally with the CFMS representation. And finally, in conjunction with the Global Health Committee, the VP Global Health plans a yearly Global Health fundraiser dinner as well as a conference. The VP Global Health and Assistant plan regular Global Health Committee meetings, which include all of the identified pillars of global health. These meetings are open to everyone, so if you're interested in hearing all things global health, drop me a line. Finally, our wonderful Global Health Communications gets the word out about various global health initiatives through social media. Running the Facebook page, managing bios, and promoting various global health events results in increased awareness and attendance to our initiatives. Make sure to give our Facebook page a like. So how can you get involved? Did you hear something that interests you? Are you looking to dabble in global health or maybe play a large role? If so, feel free to reach out to myself or any of the other global health representatives at the email below. Thanks for listening.